When you consider podiatry, you consider foot care, and that applies to people who are unable to care for their own feet, people who are at risk due to things like diabetes, arthritis, where there is a problem that they need to have someone monitoring their feet, and then the whole spectrum of anyone that has problems with foot pain.
Patients that are usually referred to a podiatrist are really anyone who has a concern regarding their feet. And sometimes it's not good to isolate the feet. It can be knee or hip or back, because the body is connected. If somebody has a pain in their foot and it's also back pain, that's definitely somebody who is suitable to go and see a podiatrist. The most important thing is a chronic foot problem. If there's a patient that keeps on having a problem in their foot over a period of time, I think they need to be referred to a podiatrist.
The sort of treatments that podiatrists do with their day-to-day patients are generally cones, calluses, ingrown toenails, assessment of the feet to see if they're at high risk of having ulcers or any problems with the feet happening, in terms of diabetic patients, arthritis patients, the way they're walking, the pressure points in their feet, and how it's related to the rest of the body in terms of their knees, lower back and upper body as well. So if we see patients who've got complaints about the way the pain is, we see how they're walking and how they're standing, and then we can understand whether it's coming from the feet or not.
Nail surgery is quite a simple process in most cases. There can be both a partial nail avulsion or total nail avulsion, so that's PNA and TNA. Partial nail is basically just taking down one particular side, whichever side is affected, and taking down to the base of the nail, to the cuticle, and then putting a chemical into the side to prevent a regrowth of that nail, and thereby reducing or eliminating that risk of ingrown toenails altogether. A total nail avulsion may be something that may be appropriate for very thick nails and nails that grow back very, very deformed, such as gryphotic nails, which may cause pain if they become too thick. And so we can totally remove that, and again we apply a chemical to stop that growth of the nail and prevent that from regrowing and causing pain.
Children can benefit a lot from podiatrists. One of the most important things is walking, gait, and this starts at a very young age. And I sometimes feel that adults which present with a lot of biomechanical problems are people who were born with a particular problem, and because it was not treated when they were young, it's just manifested to either an injury later on in life. So I believe in preventative podiatry. I think any child which is starting to walk should actually go and see a podiatrist to have their gait assessed. So I always say with children, age 1 or 2, definitely for a visual gait analysis to see everything is okay. Then every year after that, once a year to a podiatrist, up until the age of 7. That's where I think children should be seeing a podiatrist. So when a child presents, first of all, we do a visual gait analysis. We have a look at them walking. We have a look at them standing, running, stability, posture. We also look at their muscles, their range of motion. And if something's wrong, something very simple like stretching is a very simple treatment which we give to children. The next thing which I also think is something which is not emphasized a lot is footwear. Shoes are like tires. Depending on what you have on is how you're going to walk. So footwear and stretching is important. Sometimes we can offer some sort of mild functional control, but footwear has to be correct, and muscles are also very important. So stretching and footwear is something which we first start off with, and then depending on how complex the problem is, we can take it from there. And we can also refer them to physiotherapists, whatever health profession which we feel needs to come on board, we will ask them to come on board.
Musculoskeletal podiatry will be most applied to people with symptoms of pain such as heel pain, knee pain, and generalised foot pain, where you know that they've been elsewhere, can't get treatment. We often get them. So we look at their walking, we find where the inequities are, and then we use treatments such as dry needling, acupuncture, orthotics, stretching, some fascial release, and treatments such as that to get the desired result, and we have a lot of good success. A very interesting case that exemplifies the use of musculoskeletal podiatry was seen with the patient who presented with post-chemotherapy neuropathy in her feet and hands. She was quite desperate, in a lot of pain. The assessment revealed that due to this ongoing problem, she'd become very tight in her muscles of her feet and legs, and this was exacerbating the problem. Amongst other treatments, we used a lot of dry needling, compression socks, stockings and orthotics, and we have absolutely achieved a phenomenal result, reduced her pain significantly by at least 70%. With patients with neuropathy, that's very unusual.
With diabetes, we do a basic foot assessment, and that includes the visual, just looking and see any problems with the feet in terms of breaks in the skin, nail disorders, and also checking between the toes, make sure there's nothing. And then we feel the temperature of the feet. Then we we go down to check the pulses, dorsalis pedis and posterior tibial pulses, and the quality of the blood that goes into the feet. And the next part is the testing with the monofilament, then for checking for neuropathy, and finding out whether the patients have good feelings in their feet, because that really helps us on how to advise them how to look after their feet. The next part is checking the patient education to see if they understand the effect of diabetes on feet. Quite a lot of times they don't know why they need to have their feet checked, and if they know that, then they can attend to daily checkups themselves a lot better. They can conform better. So the patient education is the most important part in terms of their understanding, and also what they need to do daily and monthly for their feet. So we usually go through a booklet that we show them pictures about what needs to happen, what things they might see and the things they might need to report to us. And also check the footwear, see the fit of the shoes and their quality, and give them advice about what they need to be wearing to protect their feet.
A case study that I've seen recently is Mrs. Smith, who came in for heel pain and arch pain. Medical conditions that she has includes hypertension, hyperlipidemia and diabetes. So our initial diagnosis was plantar fasciitis. Our treatment consisted of strapping, icing and stretching exercises to reduce that inflammation resulting from the plantar fasciitis. We also addressed it through orthotic therapy and to provide extra support to the arches to prevent the collapse and stretching of the plantar fascia to reduce the pain. The things we also addressed was educating on weight loss and the prevention of pain through reducing weight.
A referral is not necessarily required to see a podiatrist. If a doctor wants to send somebody, then there's a number of ways that can be done. They can just write a letter on their letterhead asking for certain things to be looked at. They can be referring their patient through the EPC, Enhanced Primary Care Plan, with the appropriate referral form and hopefully some notes giving us a background history. They can refer the DVA patients through a DVA form, and workers' comp patients are very welcome and are often sent through doctors from insurance companies as well.
Usually patients who get referred to podiatrists are the ones which have had a problem for such a long time, and they come to us so late, and we pick up in a matter of minutes or seconds what the problem is. So the greatest benefit is that we are confident in our treatment and we're confident in our diagnosis. So the benefit is that when patients walk through the door, they usually walk away with some sort of treatment which will either resolve the problem or offer some sort of relief.